Spleen channel diagnosis. Spleen Qi deficiency. Poor appetite, slight abdominal distension after eating, tiredness, lassitude, desire to lay down, pale complexion, weakness of the limbs, loose stools, tendency toward obesity, pale tongue and empty pulse. Keywords: tiredness and loose stool. Spleen Yang deficiency. Poor appetite, slight abdominal distension after eating, tiredness, lassitude, a desire to lay down, curled up, a pale complexion, weakness of the limbs, loose stools, a tendency towards obesity, a feeling of cold, cold limbs, edema, pale and wet tongue, deep and weak pulse. Loose stools and a feeling of cold are enough to diagnose. Spleen Qi sinking. Poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, depression, tendency towards obesity, a bearing down sensation of the abdomen, prolapse of the stomach, prolapse of the uterus, prolapse of the anus or prolapse of the bladder, frequency and urgency of urination, menorrhagia, pale tongue and a weak pulse. A bearing down sensation and a weak pulse is enough to diagnose. Spleen not controlling the blood. Poor appetite, slight distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, depression, tendency towards obesity, blood spots under the skin or a petechiae, blood in urine or blood in stools, excessive uterine bleeding, sallow complexion, pale tongue, a weak or a fine pulse. A fine pulse, pale tongue, and bleeding are enough to diagnose. Spleen blood deficiency. Poor appetite, slight abdominal distension after eating, tiredness, lassitude, dull and pale complexion, weakness of the limbs, loose stools, depression, thin body, scanty periods or amenorrhea, insomnia, achy joints, pale, thin and slightly dry tongue, choppy or fine pulse. Cold dampness invading the spleen. Poor appetite, fullness of the epigastrium, abdomen, a feeling of cold in the epigastrium or abdomen, which improves with warmth, a feeling of heaviness of the head and body, a sweetish taste or an absence of taste, no thirst, loose stools, lassitude, tiredness, nausea, edema, a dull white complexion, excessive white vaginal discharge, a pale tongue with a sticky white coating, slippery and slow pulse. Fullness and sticky white tongue coating is helpful for diagnosis. Damp heat invading the spleen. Fullness of the epigastrium or lower abdomen. Epigastric or lower abdominal pain. Poor appetite, a feeling of heaviness, thirst without a desire to drink, nausea, vomiting, loose stools with an offensive odor, burning sensation around the anus, feeling of heat, scanty dark urine, heaviness of the head, a dull yellow complexion like a tangerine peel, yellow sclera of the eyes, oily sweat, a bitter taste, itchy skin or skin eruptions, sweating which does not relieve the fever and does not lead to the clearing of heat, red tongue with a sticky yellow coating, slippery and rapid pulse. Spleen and heart blood deficiency. Palpitations, dizziness, insomnia, dream-disturbed sleep, poor memory, anxiety, a tendency to be startled, a dull, pale complexion, pale lips, tiredness, weak muscles, loose stools, poor appetite, scanty period, pale and thin tongue, and choppy or fine pulse. Spleen and lung qi deficiency. Poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, a tendency towards obesity, slight shortness of breath, slight coughing, a weak voice, spontaneous daytime sweating, dislike of speaking, a tendency towards catching colds, dislike of the cold, pale tongue, and an empty pulse. Spleen and liver blood deficiency. Poor appetite, slight abdominal distension after eating, tiredness, lassitude, dull pale complexion, weakness of the limbs, loose stools, thin body, scanty periods or amenorrhea, insomnia, dizziness, numbness of the limbs, blurry vision or floaters in the eyes, diminished night vision, pale lips, weak muscles, cramps, withered nails and brittle nails, dry hair and skin, slight depression, a feeling of aimlessness, pale tongue, especially on the sides, choppy, fine pulse. Obstruction of spleen by dampness with a stagnation of liver qi. A feeling of oppression and fullness of the epigastrium, nausea, lack of appetite, loose stools, a feeling of heaviness, dry mouth with a desire to drink, sallow complexion, bitter taste, epigastric and hypochondriac pain, and distension, irritability, thick, sticky yellow tongue coating, slippery and wiry pulse.